I'm a radiologist. I thank World Heart Federation and Sathya Health Mission uh, and the entire team of Sai devotees and organization for having me here to share some of my experiences on preventive cardiology and role of CT scan and calcium scoring. The pitch has been laid down perfectly that started with diabetes, then hypertension, then risk factors, then stress. So you have everything there. The menu is there for the heart attack. How we are going to prevent it is what we are going to look at. And what I'm going to tell you in next couple of minutes is that, number one, I'll not stress you out by showing all my slides. Number two, I will not stress myself out by trying to finish the slides in time or less than time. So let us try to understand why are we trying to prevent a heart attack? This is a preventive cardiology. Why should you prevent a heart attack? So you prevent a heart attack because a heart attack occurs because of a plaque, that is atherosclerotic plaque, which ruptures and causes a infarction or a heart block or muscle. Dead, heart muscle is dead. So what happens if heart muscle becomes dead? Two things can happen. If it happens acutely, patient will not come to hospital. He'll die within a few minutes. Now, if he survives that period and comes to the hospital, depending upon the extent of damage, he can have a maximum amount of muscle damage and he can lead a crippled life. I mean, his maneuvers are wasted. He cannot go to the washroom. He develops breathlessness. So many things, complications. He has to put on a pacemaker. He need to have drugs. Probably has to go for a stenting or a bypass. So you are going to prevent a heart attack. It could be in adults or in young adults. What we'll come to later on. To avoid these things, sudden death, a family has to struggle with sudden death, which is catastrophic. Or with the individual standing in front of you, developing heart failure, he cannot do his regular activity. He has to be taken to hospital regularly. He has to spend so many medications, so much of morbidity. To prevent that, we are going to tackle the preventive cardiology is what is the theme today, and that's what we are going to look at. Now, how do you prevent? Even before, how do you prevent is that you try to test the individual, look for diabetes, look for hypertension, look for stressful lifestyle, look for family history, look for high lipids or lipidemia. First is the foremost. You look at those risk factors. If someone doesn't have any of the risk factors, you are almost sure evidence-based imaging or evidence-based medicine that he'll not fall into the category of developing a heart attack. So leave him alone. But again, there are some caveats there. We'll come back to it. Now, the next thing you should do is a treadmill test or a stress test. When you do a treadmill test or a stress test, it is going to tell you whether this person at peak stress will develop this abnormalities in the stress, which indicates that he might develop a heart attack or not. That is one. So you've got the traditional risk factors. You've got a treadmill test, which is going to tell you that this patient might develop a heart attack or not in the near future. What we have seen in this last decade, that all the risk factors, number one, and even treadmill tests do not have a high degree of accuracy in telling you whether this individual is likely to develop a heart attack or not. Treadmill test has 25% false negativity. That means if you do in 100 people, 25% will be labeled as normal, but they will develop to have a heart attack in the near future. So here comes the lore of radiology, that is the calcium scoring and CT angiogram, where if you do a calcium score, CT calcium score, or a CT angiogram, these individuals can be picked up at an early stage of developing heart attack. I mean, the plaque formation, plaque buildup in the coronary arteries, and you can prevent a heart attack if you know that this individual has a deposits of lipid or calcium within his blood vessels. So, in whom should we do this? In whom should we do this? Now we'll come back to the risk factors. Keep it aside. What we have seen in the last 2 or 3 decades is that, in addition to the traditional risk factors, in India, family history, family history, family history. All, I mean, that is so important that if an individual has a strong family history of heart disease or coronary artery disease or sudden cardiac death, these are the ones who are likely to develop a heart attack very often. So what is meant by premature heart disease or premature heart attack or premature coronary artery disease is a family member less than 50 years of age developing a heart attack. If a family member has less than 50 years of age developed a heart attack or a stent or a bypass surgery, this individual is most likely to develop a coronary artery disease most often with the background of stressful lifestyle, hypertension, diabetes, smoking, hyperlipidemia, so on and so forth. So that is the background, that is the basis, that is the kind of, the root cause is the family history, family history, and family history. So my topic today is catch them young. Is you have to. I mean, this is imperative. At the end of my probably last 1 minute, I'll tell you what we should do. Is that we have to prevent in young individuals this premature CAD. India now is going through number one. India is the breeding ground. India is the world's largest population, world's capital of coronary artery disease. And on top of that, India is becoming like T20 champions, under 14 champions, under 20 champions. Now we are becoming the world capital for young stroke, young coronary artery disease. That also we are becoming capital now. So we have to prevent that. How do you prevent that? That is what is the crux of the story today. How do you prevent that? That means you identify those individuals less than 40 years of age, those individuals who have a family history of coronary artery disease or a premature coronary artery disease. Now, at one side, and the other side, is he a smoker? Is he a diabetic? Does he have a high cholesterol? Does he have a high LDL? Does he have low HDL? So these individuals are going to be picked up. And these individuals, if you do a CT coronary calcium score, or if needed, CT angiogram, these can be, you can prevent a major heart attack in these individuals. So that is where the role of radiology comes. You pick up these individuals, try to pick up. We should do a lot of survey, a lot of activity to prevent stroke in the end. And what is difference in India? What is the difference in India in this stroke? Is that in the young stroke, especially in India, these people develop coronary artery disease at a young age, number one. Number two, they develop a very massive disease from the beginning itself. And number three, their morbidity and mortality are so high when the heart attack occurs at young that these individuals, will lead a crippled life in the subsequent of the whole whatever is left of in their life. So this is what is we have to prevent. And what are we going to do to prevent this in young individuals? Not talking on the podium like this, not listening to lectures, what I'm going to tell you, and not organizing conferences, but we have to go out. And I request the Sathya Health Mission and World Heart Foundation to start this program of trying to identify the young individuals who are at risk to develop a heart attack. Go out, do whatever is needed, including a CT calcium score and a CT coronary angiogram if needed, and then prevent the young Indians from becoming vulnerable to develop this heart attack and prevent a major heart attack or prevent death, and also to prevent a worst outcome, morbidity and mortality. So that is what we have to do. So we have to talk in conferences, also try to reach out to the public and then do something. And I request these two organizers here to take it up as a challenge in India, if not entire India, in some part of the India, where if we can do a study along with Mohan Foundation, and we have so many here, that we try to prevent stroke in young, less than 40 years of age, by identifying these risk factors. And if needed, just take the help of radiology, especially CT calcium score and coronary angiogram, and try to do a much better activity in preventing actually going to the ground level and kind of helping young India. So why I'm stressing on CT angiogram and CT calcium score is that the CT calcium score or CT calcium is a marker for coronary atherosclerosis. The CT coronary calcium occurs only because of cholesterol and nothing else. And the cholesterol is the one which is the major culprit to develop the heart attack. So a cholesterol deposit becomes calcified and causes blockade. So if you have to look directly at a artery, that is CT calcium score, which is going to tell you directly that this individual has coronary atherosclerosis. So why are we going to look at the coronary atherosclerosis at young age? If I have to tell you that if some calcium score is normally 0 and 100 is mild and 400 is severe, in an individual coming to me at 30 years of age, if his calcium score is 10, that means when he becomes 50 or 60, it becomes 400 or 500. That means so much of risk he has now. Today he has a risk. So that is what the calcium score and the CT angiogram will tell us, that the calcium deposition is nothing but atherosclerosis in the young individual. And if you try to do in a target population, you identify them, prioritize the pre-mortality or pre-event risk, and then try to take these individuals, assess the coronary artery risk in these individuals. I mean, we can prevent the heart attack, we can prevent morbidity, mortality, and we can save young India. Thank you very much for your attention. Any questions, I'll be happy to take. If none, thank you very much.